where daily health is viewed as an ever-changing reality. Welcome. This is Daily Health. All information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. Now, this podcast contains some quotations, images, and excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Fair use refers to the right to reproduce, use, and share. Good morning and welcome. This is your Let's Talk Daily Health. I am your host, Tony Williams. Okay, so today we'll be talking about Afib triggers. What is Afib? Atrial-fibrillation, or Afib for short. It's a condition that affects your heartbeat and can lead to an increased risk of stroke. Well, the good news is that you can help prevent it. Learn some of the lesser known triggers. Now, there are a lot of people who may not be aware of this condition. Go ahead and do your research, look it up, and you might find some surprising information. Now, air pollution and intense exercise can lead to an attack of Afib. Now, from its triggers to its symptoms, atrial fibrillation, Afib for short, can be unpredictable. Just as you can have atrial fibrillation without visible symptoms, you can experience an attack of atrial fibrillation without a trigger. Now, that was stated by Dr. Smith Vasawela, MD. Now, if I messed up your name, I sincerely apologize. He's an assistant professor of cardiology at the Loyola University Health System in Maywood, Illinois. But most people are able to identify at least some of their Afib triggers. And this knowledge can help you decrease the frequency of attacks and lower your risk for stroke. Now, if you're not aware of common Afib triggers, they are including alcohol, smoking, exercise, and over-the-counter cough and cold medications. But have you considered the lesser-known triggers that can be just as harmful to your heart? Like, for example, mental, emotional, and job-related stress. There have been a number of studies linking mental health and mental stress with Afib. So we really have to just take our time, breathe, relax, and just recenter and refocus ourselves so as to not trigger Afib. Now, Afib is an abnormal heart and rhythm condition. And research has shown that on days when people are feeling very anxious, stressed, or angry, the likelihood that their heart will go out of rhythm is significantly increased. Now, a study was published in May of 2018 in the European Journal of Preventive Cardiology found that job-related stress or job strain was associated with nearly a 50% increased risk of Afib. Another study published in November of 2018 in the American Journal of Cardiology found that traumatic events such as life-threatening illness were significantly associated with Afib among women. Even perceived stress can increase a person's risk of Afib. The heart is often a manifestation of what's going on in our lives. This can include situations that cause stress, anxiety, depression, and anger. That's why it's important to pay attention to all aspects of your health, including your physical, mental, emotional, and relationship health. It is very important to be aware because we can't take any chances. Now, as I stated before, air pollution and environmental factors do play a role. Although some research is still emerging, some studies have demonstrated an association between air pollution and a higher risk of AFib. Now, a study published in June of 2017 in the International Journal of Environmental Research and Public Health showed that increased exposure to air pollutants within the previous 24 hours was associated with a greater number of AFib-related emergency room visits. Now, in another study published in March of 2017 in Environmental Health Perspectives, researchers in Denmark found that a long-term exposure to traffic-related air pollution correlated with a higher risk of AFib. So we really have to be aware of our health and what environments we put ourselves in or exposed to, especially prolonged exposure. Now, certain foods and beverages, there are triggers there as well. The triggers for AFib can be very specific to the patient because, well, we know everyone is different. In some cases, patients experience increased AFib episodes after eating cold foods like ice cream or drinking cold drinks. Other patients report more AFib episodes after eating certain types of cuisines, such as Chinese food. So the main thing is to be aware of your specific food-related triggers. It may help to keep a food journal in order to know which foods may be associated with your episodes. Now, for people who enjoy a cup of coffee, you may be in luck. Healthcare providers have historically warned people with AFib about the potential harm of drinking caffeinated beverages, but a comprehensive study published in April of 2016 in the Journal of American College of Cardiology and Clinical found that the tea and coffee are safe for people with AFib when consumed at moderate levels. In some cases, tea and coffee may actually be protective against AFib. Now, I don't know about you all, but I'm happy about that because I do enjoy a good cup of coffee as well as a great cup of tea. But as we all know, all things must be in moderation, which is very important. Which brings me to the next factor. Too much physical activity or the wrong types of exercise. Now, AFib is often considered a lifestyle disease. Now, that was stated by Dr. Ettes. To reduce your risk of AFib, it's important to follow a healthy diet, manage your weight, and to exercise on 5 or more days of the week. More exercise, however, is not always better. In fact, vigorous exercise can actually cause AFib. Now, so what is vigorous exercises? Well, here's examples. Includes strenuous hiking, long distance running, or very high impact aerobic exercises. So it's important to find a sweet spot, and it appears to be somewhere in the middle. Regular but moderate exercise. Again, everything in moderation. So if you're considering a new exercise program, talk to your healthcare provider about the best plan for you. Many find that walking is a good start. You may also want to consider a heart rate monitor to ensure that you stay in a safe heartbeat range. And another useful guide is whether you can carry on a normal conversation during exercise. If you can't, the intensity is probably greater than moderate. Now, sex hormones. Some research shows testosterone in men is associated with a higher risk of AFib, whereas a study published in July 8th of 2018 in the European Journal of Cardiology shows the opposite. And then a study published in October of 2017 in the Endocrine observed that higher levels of bioavailable testosterone in men was associated with a higher risk of AFib. Now, for women in the study, however, higher levels of bioavailable testosterone were associated with a lower risk of AFib. So for the long term, the importance of lifestyle changes and tracking your pulse is going to be a great help. Long term, what works the best to prevent or manage AFib is lifestyle optimization. This includes maintaining a normal body weight, eating a healthy diet, getting great sleep, and regular physical activity. Lifestyle changes can take care of about 50% of AFib cases. For those who don't respond to lifestyle changes alone, the next best long-term option is to get Afib ablation, which it's a surgical procedure in conjunction with lifestyle optimization. Now, everyone doesn't jump and run for the last resort, which is most of the time surgical procedures. But if you've already been on this journey and you're at your last resort, there you have it. Now, day notes that tracking your pulse is easy and can be done in as little as 10 seconds a day. You can use devices like the Apple Watch 4, which has an FDA-approved electrocardiogram, ECG monitor for short, built in to help detect AFib. If you don't want to buy a watch or other wearable devices, you can also take your own pulse without any special equipment. Now, the main point is to be sure that your pulse is not too fast or too slow, and that is not too irregular. So what is a normal heartbeat or heart rate? A normal heart rate for most people will be about 50 to 90 beats a minute, and it should be regular. If you have a chaotic pulse, there's a good chance that you may be in AFib. So hopefully this has been some great information for you. And I'll throw in a tip. Eating more protein could ward off atrial fibrillation in older women. So take your time, do your research, learn about atrial fibrillation, and just be aware of your body. We have to be in tune with our body so we can understand the signs and the signals that our body is giving us, trying to warn us or tell us that something is amiss. And for atrial fibrillation, it is something that you should be aware of and take care of as soon as you can. But don't let it stress you out, and don't let other things stress you and trigger. So these have been some surprising triggers for AFib, which is short for atrial fibrillation. It is a disorder and condition that you can live a long, pretty well healthy lifestyle with having. It just takes a little effort. And you guys can do this. So I would appreciate your feedback, any questions you may have, or any comments you'd like to leave. Thank you for your time. This has been Surprising Triggers for AFib, atrial fibrillation. Take care of yourselves. You have been listening to Daily Health on the On1 Radio Talk Show podcast station, where daily health is viewed as an ever-changing reality, which we know it is. If you would like to get in contact with On1 Radio Daily Health, you can email on1radiotalk@gmail.com. Place it to the attention, please,